So good evening, one and all. Welcome all to Vayomanasa Sanjeevani's webinar series. Today's webinar topic is dreams and nightmares. To talk about this, we have Dr. Vijay Harbishatar, and our moderator for the day is Mrs. Sudha Nagendra K. With that, I would like to welcome all the Zoom and YouTube attendees for today's session. Introducing Sudha ma'am. She have completed her master's in MSCP in psychotherapy and counseling, and she's working as a faculty and a counselor at Banjara Academy. And she's also a vice president of Swami Vivekananda Education Society and a member of Samadhana Counseling Center. I welcome you, ma'am, to address our speaker for the day and to introduce about Vayomanasa Sanjeevani. On to you, madam.
Thank you, Gina. Welcome to today's webinar series from Vayomanasa Sanjeevani. Today's topic is dreams and nightmares. It is a talk by Dr. Vijay Kumar Harbishatar. He is a consultant psychiatrist in Padmashree Diagnostics and he is advisor also. Health Heal and Home Health Care is their service. It's in Bangalore, and he is going to talk about dreams and nightmares. Before that, I would like to give a brief introduction about Vayomanasa Sanjeevani and its activities. Every Monday, it's an awareness to seniors. There is a program to awareness for the seniors, and there is a theme-based meeting. Only that is meant only for the volunteers. And Sandhya Karanji is, I think everybody is enjoying that. Every Saturday they are conducting different activities, activity-based program. We have we are educating professional caretakers. There is a program for that. In case anybody want to join, they can join at the below link. And the goal of Vayomanasa Sanjeevani is promoting mental health and well-being in older adults. It's an outreach initiative of geriatric clinic and services, promoting age-friendly community, promoting awareness on aging and mental health, training of lay counselors and volunteers and caregivers on geriatric mental health, psychosocial intervention by lay counselors and volunteers, psychosocial care program in old age homes, integrative medicine for healthy aging. Geriatric tele-psychiatric services are also rendered by Vayomanasa Sanjeevani Group under the guidance of NIMHANS. And today's talk, Dreams and Nightmares, is going to start now.
Thank you, ma'am, for that introduction of our initiative, Vayomanasa Sanjeevani. I would like to tell the participants that I'll be showing a video of Dr. Vijay Kumar Harbishatar about the topic. He's also available in our panel. So after the presentation, you may ask your questions and queries or share your experiences. Thank you.
I'll be discussing about dreams and nightmares. My presentation will have three aspects today. To understand dreams, we need to understand the basics of sleep physiology. I'll cover that for a few minutes in the beginning, and then I move on to dreams and lucid dreams, and then we'll discuss about nightmare disorders or nightmares. When you look at the sleep stages, this is done by the electrodes placed on top of your scalp or the head and then recorded. So when they do the EEG in an awake person whose eyes are open and he's thinking, there will be activity from the front of the brain, and if you look at the frequency of the the recordings, it's very high. So this will be the frequency basically. So it will be fast, more than 13 hertz or 13 cycles per second, more than 13 cycles per second. And then when the person is sitting, is awake, is relaxed, but his eyes are closed, eyes are closed, then it's calm wakefulness, they call it. It's similar to meditation. So when you try and relax yourself, when you're awake, you close your eyes, suddenly the wave pattern changes, and then it comes to what we call as alpha waves. The first one is the beta waves, second is alpha waves. It becomes slower, so the activity, the electrical activity inside the brain slows down a little bit. So when somebody drifts off to sleep, at that moment in time, when there is transition, what we call as stage 1 NREM sleep, there we see what we call as theta waves. Don't worry about the theta, alpha and all those kind of things, but what you need to notice is the frequency slows down. So from when it was awake state to stage 1, if you see here, there is some slowing, gradual slowing. During that period, there may be jerky movements. So in stage 1, when somebody is drifting off to sleep, they can have jerky movements, and we call it as hypnic jerks, and they're still normal. And many people complain this. Unfortunate thing is that when somebody has hypnic jerks, then they become awake for a second, and then they again go back to stage 1. So they may have some people may have repeated episodes of hypnic jerks, but that's still normal. And some people may have hypnagogic hallucinations. What are hallucinations? People hear or see things when there is nothing around them. That's what is hallucinations. That is auditory hallucinations in the voice form or whatever, or music form or other sounds basically. So call bell ringing, or somebody knocking the door, or something else. And for people who are doing night shifts, they feel as though their bleep gone off, and those kind of things. So that can happen around the time of somebody drifting off to sleep from awake state, eyes closed, to stage 1. These things can happen, and in this stage a person spends about 5% of total sleep period. From stage 1, the person moves on to stage 2. You see a difference there. In stage 2, I mentioned to you that it's about, the person spends about 40 to 50% of his sleep. So you can say that majority of the sleep is spent in stage 2 sleep. And there can be what we call as bruxism is seen, which means teeth grinding can be seen in this stage. So you need to understand that person spends 50%, half of the time of total time can be spent in stage 2, and it will not be continuous 50% of sleep. It can be bits and pieces. When you add all together, it can be stage 2. And there is something called as stage 3, or the deep sleep or the slow wave sleep. If you notice, it has turned to delta waves, where you can see that delta waves, it's less than 4 hertz. So stage 3, so the old classification had stage 3 and stage 4. The new classification includes both stage 3 and stage 4 in stage 3. So if you call it stage 3, that's the last stage, and then it includes stage 3 and stage 4. So we need not have to worry about the stage 4. Stage 4 also means stage 3. Okay, so here you can see that the amplitude has gone up, but the frequency is slow. Compared to the awake state, the frequency has gone slow, right? Okay, so that's about it. And in stage 3, or what we call as a deep sleep, in deep sleep or the slow wave sleep, sleep terrors, suddenly there may be person may be may get a bad dream, or some terror kind of an episode can happen, and the person may suddenly wake up. But again, you need to understand that somebody is in stage 3 or stage 4. This is the electrical activity of the brain, and if they need to come back to awake state, it takes a little while, and that's the reason why you can see them a bit confused when they wake up from stage 3 suddenly. So you need to understand that the electrical activity in the brain, or the cells, need to get steady to be able to fire at the level of the awake state, and then there is a lag period, slow. So you can imagine, this is the explanation, or may not be the explanation, but this is the kind of understanding that you can have, that when you wake somebody from a deep sleep, there may be some time for the person to wake up and get oriented to the surrounding. This can happen in stage 3. There can also be sleep talking and sleepwalking seen in stage 3. Let's move on. So this is what I just explained right now, just now. In the awake state, the person is in the awake state, he has beta waves, and then is drowsy or relaxed, is in relaxed state, meditative phase. Then the person may have alpha waves. So from this kind of a fast wave to this kind of a slower wave, to stage 1, again slower, further slowing, and then stage 3 you got further slowing. So gradually from awake state to stage 3 there is slowing. So what happens in REM sleep? REM sleep is what we call as rapid eye movement sleep. In REM sleep, it's fast and random. So basically, this is comparable almost, or correlate with the awake state. So that's the reason it is also called paradoxical sleep, because the speed of the waves can almost be similar to the awake state. Most of the functions of the body during REM sleep can be same as the awake state. So REM sleep is also called dream sleep. So you need to understand that people dream in the REM phase of the sleep. This is the most important thing that you need to understand here. Sleep doesn't mean a flat line that a person sleeps and wakes up. Sleep has got different stages. So if you look at, if somebody is in awake state and slowly the person moves to the non-REM phase 1 to 2 to 3, and then he can come back to 2, then go back to 3, go back to 1, then go to REM sleep. The red one is REM sleep. The first REM, when it appears, has got its significance. So it is usually by 90th minute that the first REM appears, and it may be only for 10 minutes. Imagine a person is depressed. A person who has depression may have early REM and for a bit longer period, right? So some significance, so related to the mood, you may have. So in normal circumstances, if a person sleeps well, when the first cycle finishes, by the time the first cycle finishes and the person is going towards a second cycle, he would have completed all the stages of sleep basically. And if you look at, if you divide and put a line at the 50th percent, or the half time, like for example 3:30, at half time maybe 4 o'clock, or between 3:30 and 4 o'clock, half time. So by that time, by that time, sorry 3 o'clock. So by that time the person has completed two cycles of sleep. So each cycle may be almost 90 to 120 minutes. So if you look at this particular graph, the person has spent more time in the deep sleep in the first half of sleep, whereas in the second half of sleep he has spent more time in non-REM stage 2 sleep. So the first half non-REM stage 3, second half non-REM stage 2. And also you need to understand that gradually the REM sleep, the amount of REM sleep gradually, you see the red ones, the red tape here, the red tape ones gradually increase throughout the night. So in the second half of sleep, the person may have spent more time in the REM sleep. As you can see here, REM sleep, the person has spent more time in the REM sleep in the second half of sleep. So that's the reason why one can explain that person may have more dreams at early morning hours before waking up. So the first 4 hours or 3 to 4 hours of sleep, or the first half of sleep, will have more deep sleep. The second half, although you may have non-REM stage 2, you also have REM phase, and that's why the dreams are more in the second half of sleep. And maybe is this the reason? I don't know, if the burglaries happen more in the early morning hours, because all you're doing is you're dreaming and may not notice what is happening around you. I don't know, I'm just guessing. One thing you should understand, that if somebody is awakened from their dreams, as soon as they wake up, because the speed of the frequency of the waves is almost similar to the awake state, it won't take too long for them to get oriented. They don't get confused. They wake up, they try and remember, they can remember if they want their dreams, and then they can go back to sleep. So from REM they can go back to again have the different types of cycles. So this is the what we call as the architecture of the sleep. Sleep doesn't mean what time you went to bed, what time you wake up. That's not just sleep. We have several questions we need to ask. Do you dream? What time is what kind of dreams do you get? And what is the normal period of time when you have more dreams? Is it in second half or the first half? Do you feel that you are sleeping, you're having deep sleep? So what about superficial sleep? Do you easily tend to wake up if somebody disturbs you? So those kind of, so many questions can be asked. It has got its own world. So most of this will be covered by Dr. Ravindra when he in the next few weeks or so. Okay, REM phase, I won't take too much of your time here. So you need to understand that it's the frequency is similar to the awake state. All muscles except eye muscles are paralyzed. What it means is, so when you're dreaming, your hands and legs, imagine if the hands and legs start move when you have dreams, and imagine you're in the battle with somebody and you're holding a samurai sword in your hand. So your bed partner has got no option but to run away. So this is a safety mechanism that has been ingrained, that you still dream but your hands and legs will be paralyzed, so you can dream, but eye muscles will be moving. That's why it's called rapid eye movement sleep. Dreams can be recalled and person will be oriented. Like I mentioned, nightmares can occur in this phase. They're able to what we call as lucid dream. Do you know anybody what is lucid dream? Lucid dream is nothing but the person at the real time knows he's dreaming while he's in dream, and some people have the special ability to know or remain aware that it is a sleep world and a dream world, and they try to navigate the way they want in their dreams. Okay, so next, so in this phase, like I mentioned, REM latency is changed in depression and many other psychiatric problems. So it has got its significance. So in non-REM phase, sleep terrors are common. Woken up is confused. We already mentioned dreams not recalled. In REM sleep, the bizarre experiences. The time has no value. So you can have 3-hour movie in 5 minutes in REM sleep. So when you wake up, you feel that you've had a long dream and it's very lengthy, so that can happen, and the body and the brain is almost similar to waking up. So one needs to understand that in sleep the person is not, although the person may be feeling that he's taking rest, it is not a rest to the brain. The brain remains very, very active during sleep. So it was a myth that you need to have full stomach so that you can sleep and and snore. So that's not advisable. So you need not have full stomach. It is a very active phase, and you need to understand that sleep must be given its due importance. And if sleep has its architecture and you go through the cycles, you are likely to function very well. And if your kids or your grandchildren have got exams, or your friends or colleagues have exams, then they can sleep well, and their memory can improve when they sleep well. When they sleep well, their immunity also improves. What happens if the person is not able to have enough REM? When the rats were deprived of REM, they had problems, and even some rats died within a week, and their long-term memory got affected. So it can contribute to weight problems in teenagers. The pain sensitivity may increase. This was a study done before. In REM sleep, I don't go into these details. There will be a lot of changes that can be recorded. Stages of sleep, like I mentioned, you can call these like this: awake state. Non-REM stage 1 and 2 can be called as light sleep. Non-REM stage 3 can be called as deep sleep. And then the other one is REM sleep. If you want to know whether how much time you spent and you want to know the cycle, how your pattern is, you can have polysomnography. I'll tell you in a minute. So don't underestimate your sleep. You need to respect your sleep. Polysomnography, this includes recordings from the brain waves. The electrodes are kept on the scalp or the head and recorded. There is something called as EOG. The eye muscles are recorded. There is also recording of the nasal and means airflow from the nose and oral from the mouth as well. There will be recordings from the chest and abdominal movements. There's also pulse oximetry throughout the night, saturation and heart rate monitoring. There's also ECG. There is EMG, looking at muscle tone, what happens. So in REM sleep, if the muscle is paralyzed, the tone goes down. So these things can be recorded. There can also be video recording using night vision camera, right? You can actually find some of these videos of sleep studies from YouTube. There are several. If you contact me, I can give you some of the links. So this is how the typical polysomnography is done. So it is it is all placed by the technician, and then the person is advised to sleep as though he is sleeping normally, and then he then these things are recorded. If the person wakes up in the middle of the night to go to the washroom, then that is also helped, but that is also recorded. This is how the typical recording might be. The sleep technician works around it and brings and provides a polysomnography like this. And if you look at the hypnogram or the sleep study cycle, you can see here there was some awakenings here, here, and this is the REM sleep. This is REM sleep. This is REM sleep. And if you can see here, the person spent time in non-REM stage 3 in the early phase, but not at the later phase. There's no REM 3 here, non-REM 3 here, stage 3 or the deep sleep here. So this is what it is. Before coming to the sleep study, the person is advised to complete a diary for at least 2 weeks. So if you look at this, this is the time the person went to bed. approximately this is the time when the person says he might have drifted off to sleep, and this is what he's recorded now. And there was some awakening here, and then the person remembers having got up at 9 o'clock, and he wakes up from the bed at this time. So the circles indicate the time to go to bed, time to wake up from the bed. So the person is in bed from this dark circle to the lighter circle, and but the person was in sleep during only the in-between phase. The C means indicate the coffee, amount of coffee the person has consumed, coffee or tea, whatever. So this is how the person is recorded, and then based on this we can conclude, right? So how is sleep quality assessed? So like I mentioned to you just now, total sleep divided by time spent in bed. If the person is not going to sleep unnecessary, you should not be spending time in bed. That's not advisable. It's better the person wakes up and do some other activity. So we call it as sleep efficiency when the person has lower sleep period and compared to the time spent in bed. So total sleep divided by time spent in bed. For example, the person was in bed from 10 o'clock to 8 o'clock in the morning, but was able to get only from sleep from 12 to 6. So roughly about the total sleep here is 6 hours, but he spent 8 hours in bed. So 6 divided by 8 hours, that is his sleep efficiency. So that's how you calculate sleep efficiency. The more the better. The close to 100% is better. Sleep latency is the time spent in the bed by the time the person is drifting off to sleep. REM latency, the first appearance, the time taken for the first appearance of REM. So why I'm saying all this to you is basically there is science there. Sleep is not just a simple go to bed, wake up and all that. Unfortunately, there are not many sleep labs in Bangalore. There is Jain Hospital, there is I think in Narayana there is one. So there are only 2 or 3 places in Bangalore that I am aware of. Manipal is another one. So 2 or 3 places where sleep studies are done. But if you want a sleep study to be done, you can contact one of the representatives who can even do sleep study at your house. But that will not cover other things. Only few things can be covered. Okay, so that's about it. So what happens in the lifespan? For example, during birth till the first year of life, the person spends how much? 16 hours to almost 12 hours by the time the person is 1 year old. From 1 to 10-year-old is spending about 10 to 12 hours in bed. And then gradually after the age of 60, so senior citizens, they require how much? Roughly about 6 hours. So if the senior citizen is sleeping a lot during the day, unlikely that they'll have adequate sleep at night. If they sleep 2 hours in the middle of the day, then they may require only 4 hours at night, and this will be a problem. So they keep complaining that they're not got enough sleep. The problem with night is that people can become lonely, and some people may have some kind of a phobia, some anxiety related to darkness. So that we need to understand. People don't like darkness, so they hate. So that doesn't mean that the person wakes up and starts looking at the phone. That is also not advisable. So best thing to do is avoid any nap during the daytime. If at all, 5 to 10 minutes or 20 minutes power nap, so-called power nap, maybe. That's also not recommended, but worst case scenario, one power nap during the daytime, and at night they sleep adequately. Let's go on to dreams and lucid dreams. So dreams occur mainly in REM sleep. I've covered already. Dreams may or may not be recalled. The person remembers mostly. If the person wants, they can remember. So they can train their mind. So some people say that before you wake up, you get out of the bed, you try and remember dream as much as possible. So once you start training your mind, then you'll be able to recall most of the dreams. During while the person is dreaming, there may be awakenings, micro awakenings, but the person may not remember that micro awakenings. Some people say that they never dream. That's unusual for somebody not to dream. It's just that they may not have memory for that period. Good dreams people enjoy, so it's fine. It's a God-given gift. Enjoy, dream, because in dreams life looks different, and you enjoy as though you are having the same kind of sensations at night. Occasional bad dreams may sometimes help, could act as an emotional outlet, and sometimes if they're having occasional bad dreams, I would say it's fine, because some bad experiences you had in the last few weeks or so is going out in the form of this, so there's an outlet. So in dreams, people say that, some scientists say that you're almost touching your subconscious mind. So it may be that you're clearing some of the conflicts that you may have had in the subconscious mind. In terms of psychiatry, we have so many things, so I won't go into detail. So what is psychosis or schizophrenia or the hallucinations or those kind of experiences? It's just the same as what you have experienced in dream, but the only difference with regard to schizophrenia or psychosis is that the person is actually awake. That's the only difference. So when the person is acting bizarre and being diagnosed as schizophrenia or hallucinating, all you need to understand, this person might be dreaming, but the person is awake. So he's having the same experience in the dream, all experience in the dream, but in awake state. Lucid dreaming, like I mentioned, awake state. You can influence dream content. It was also called as Tibetan yoga. So some people have this special ability. Actually, some people have were able to practice their skills. They're able to practice the piano and all these kind of things. Some people have generated creative ideas or insights into some of the problems, and they've solved when they wake up. So some people have been able to change the nightmares. So a nightmares, a devil chasing them, they're able to convert and made the devil friend, and then they sat and had fun with the devil and those kind of things, and they have fun at night also. So this is a Kannada movie called Lucia, and it's based on the lucid dreaming, and they have introduced what we call as a fiction. A pill has been introduced that would induce the sleep as well as lucid dream. This person is having insomnia. The person is not able to sleep well, so the person is given a pill that using that the person is able to lucid dream. That's what the fiction is. So this is a person who is a celebrity. The celebrity dreams of a poor cinema security person. He wants to become a poor security person sitting in a theater and helping people to find their seats. So he's actually a celebrity, but he doesn't want the stardom. He then starts getting confused that his dream world is his real world, and that his current real world is not his world. So it's a bit of an interesting story, complicated. So you may need to watch few times and then understand. That's a very nice movie. And in this movie, Insidious Chapter 1, so it's just to educate you people that so this movie is based on the where you can go to a different world in your REM sleep, and so many things happen, so many experiences will happen, and you as though you go to a different world. Just fiction added, and just to help you understand that dream world is different, and a person having REM sleep, some people their theory is that you go to a different world altogether. So nothing is proven in this angle. So parasomnias, nightmare disorders. Let's move on to nightmares. Nightmares. So person, what is nightmare? It's just a dream. That is a bad dream and scary dream where the person gets up and he has some recall because he's scared. He may be sweating when he wakes up and he's scared and he's almost very anxious and he's not able to tolerate and he's worried that he's almost died. His or his family is in danger, and he wakes up and then he understands what is going on around him, and he is oriented and alert. Now, because there is distress, he's worried that if he goes back to sleep, he'll go back to the same world. He's worried and he tries to avoid that. He's looking at the watch, he's looking at the clock, and he wants the night to finish. So just because you have nightmares doesn't mean that it's nightmares, so we need to be diagnosing it. So there are other conditions which look like this. There can be what we call as fits. Fits look like dreams or person suddenly waking up from sleep. So there are other conditions. Narcolepsy is another, REM behavior disorder is another. So we need to rule out other things also. So nightmare disorders are a type of mental disorder. So it's almost 8%, and this negative impact on the daytime functioning. So imagine if the person is getting awake every night and is not able to sleep adequately, his performance at work will get affected, right? So it's associated with sleep avoidance. So the person tries to avoid sleep, and he is finding other people to console him, and it compromises his sleep quality. It is common in females. The current practice is that many clinicians think that nightmares are normal and that doesn't require any treatment. Then if you ask the neurologist, they want to rule out the REM behavior disorder, because in REM behavior disorder, like I already mentioned, that when person is dreaming, their hands and legs are not working, in the sense they're paralyzed during while the person is in REM sleep. But in REM behavior disorder, what happens is the person is awake. The person is not paralyzed and he can move his hands and legs. So that is REM behavior disorder, and it's a danger to the sleeping partner. So for general practitioners, sleep terrors are important. So for nightmares can be just incidental finding in the sleep laboratory. So what happens after detecting nightmares? So I think you need to see a psychiatrist. We can manage. So there are some scales also we can use. Nightmare distress questionnaire also can be used and find out how bad is the nightmares, and then based on that we can have a diary also, and then based on this diary then we can work around it. And there's some medications which I won't go into details, and there's something called as lucid dream therapy. It works apparently. There's also called as image rehearsal therapy based on cognitive behavior therapy techniques, and we can use those techniques. So nightmares are fully treatable condition. So the image rehearsal therapy done it's found by Barry Krakow in USA, and it's also called as new dream therapy. So here what they do is the dreams recalled are written in diary after waking up, and the sequence of events and scary parts of the story are studied, and the line of story is changed and repeatedly rehearsed before going to bed. This is a simple method based on cognitive behavior therapy. You need to try and replace the scary thoughts by positive thought. So when a person was asked that, so every time this person was complaining that every night the devil or the bad monster was chasing this person in dream, and people gave idea that, have you ever thought of asking this devil or that scary monster what is he up to, what is he or what is she up to? Then so the person, because she was repeatedly rehearsing that, thinking about it, he or she actually at night asked that thing to the devil. I don't know, it's just, I don't know, I'm not trying to scare you, or something like that. So dreams can be changed. It's all mindset. So I think it's related to subconscious mind. So before going to bed, there has to be clarity. So some people say that you need to avoid thinking or looking at crime stories and things, or any scary movies or anything. You should avoid all that. You should focus more on spirituality, or even better things, that it might be your hobby, and you need to go to bed smiling. Then you're likely to have better dreams. So with this, I conclude my presentation. I must thank for your patient listening. I'm ready to take any questions. Thank you, everyone. Thank you.
Thank you, doctor.
Thanks.
Yeah.
Thanks, Madam Sudha. Madam Sudha, can I, if that video can be taken off, can I show some videos that might be
Yes,
useful, I
sir.
think.
Yes, sir. Yes, sir. You can
Okay.
share the
And
screen, sir.
see a shared screen. Okay, the first video is, these are all educational video, just to educate only. There's no commercial, no commercial involvement in this. So it's for, to help people understand its health education purpose. Okay, this is the first one. This is obstructive sleep apnea. You can see what happens in obstructive sleep apnea. Can you all see the person lying? You can see the short periods of person becoming hypoxic, unable to breathe. Because of the narrowing of the breathing space, there are times when he's unable to breathe, and then he wakes up. Every time he's, it's blocked, he wakes up. So there'll be multiple awakenings. He may or may not remember all these awakenings. So so this can be recorded from the polysomnography. So there are correlations with when the saturation even goes down, and then there is sudden stoppage of breathing, and then the person wakes up. So there will be multiple awakenings, and you can imagine if somebody is not sleeping adequately continuously, and there are multiple awakenings. If you add everything together, then there will be definitely reduced sleep efficiency, reduced sleep time, and their next day work can be impacted. So sleep apnea is something that uh, on just snoring is not an issue, may not be an issue, but still, if when there is significant snoring, still a person need to go and see a specialist, sleep physician, or ENT specialist. But if snoring is significant, there could be severe blockage, and then that will cause awakenings, and then a person wakes up. This looks like a nightmare, but it's not nightmare. It's not even dreams. It is definitely a sleep related problem. Respiratory physicians will look into it. Just physicians. This is REM behavior disorder. There's a question on this. I'll come to that in a minute. What is REM behavior disorder? Like I already mentioned, here legs and hands are paralyzed in a normal person in REM sleep, but here it is not paralyzed. So he's able to move in his dreams. Now, how do I know it's not a fit, or it's not something else? This is because through the EEG recording, we know that this person is in REM phase. From the EOG, eye movements are happening. There we know that the person is in REM phase of the sleep, and then but he's moving. So this is how we know that what phase of sleep is in. Fits can occur in sleep that can easily be missed. So I'll just show you this. Yeah. Again, how do we know it's seizures? It's not something else. Again, based on EEG recording. So EEG recording will tell us it was a seizure episode. This one, sleep terrors. Sleep terrors occurs in deep sleep. So dreams can occur in many phases, but mostly in the REM phase. But sleep terrors is related to deep sleep. This is the last one. You can see the person is confused, still not sure, is not disoriented to surroundings, is not sure. Okay. So I'll stop sharing. Yeah. Madam Sudha, over to you. We can't hear you, ma'am.
Ma'am, you're on mute. Yeah.
So he is asking that, does dreams indicate anything?
Maybe it's related to past experiences of the person. It's nothing, or person having heard some stories or anything like that. So it's all related to past experience. It can only be related to past experience. I'm not talking about past life. I don't know about past life. I'm saying past experiences. So childhood or anything. And that's the only thing. So where is the dream coming from? The dream is coming from the person, right? So from the person's mind. So what is in the mind? Whatever the person had, all the experiences in his lifetime. So it can be something related to recent episode or anything like that. So people think that they dream and that it happens, for which the science is saying that there's no proof, there's no evidence, and if they feel, they can always keep a diary and see if that happens, that occurs.
And another person is asking how to treat sleep disorder in elderly. Yeah.
Most common problems in elderly are, again, insomnia, not able to sleep well, for which sleep hygiene is the first thing. Sleep hygiene is what time you go to bed, what time you wake up. It has to be standardized. And we all know that for senior citizen, they require only up to 6 hours, or maybe 5.5 to 5.5 to 6.5 hours in between that time. So if somebody is sleeping during the daytime, they should avoid, like I already mentioned, avoid sleeping for long hours during the daytime. And at night before going to bed, some positive activity, not very, you shouldn't make mind very active. So you can even do something which is boring, some boring related stories, or some boring related things, even mantras, if you want, spirituality, and some story, related, some myth related, the mythology related stories or anything, something related to boring they can do. Don't do a lot of walking before going to bed. No yoga exercise before going to bed. No hot water bath. I won't recommend hot water bath or anything like that before going to bed. Avoid tea, coffee after about 5 or 6 o'clock in the evening. And then don't drink too much water at after 7, 8 o'clock. If you do all these things, because if you drink a lot of water, it takes, if your kidneys slow down, then it will take 2-3 hours, then the bladder is full, and then you want to wake up in the middle of the night. And it depends on where the restroom is at home. If it's quite close and they're able to go and use it in 2-3 minutes and they come back to bed, and if they don't do clock watch in between, or they don't look at their phone in between, they're likely to go back to sleep, drift off to sleep immediately. So it's okay to wake up, it's not a big deal, but try and avoid by not drinking too much water. So sleep hygiene should be maintained. Sleep hygiene, one has to respect sleep. You cannot underestimate sleep.
Another person is asking, one of my relatives 60 plus in deep sleep suddenly shouts peculiarly. After patting, he will wake up, and when we ask, he says nothing.
Okay. This is probably one of the episodes that happened in that video. I don't know whether you had a chance to look at the video. There was sleep terrors. From the face value, it looks like a sleep terror, because there's a lag period by the time the person is gaining full consciousness of what is happening. There's some lag period from what you're telling me. So if somebody wakes up from a bad dream, the person himself will tell, I had a bad dream. But in sleep terrors, the person may not be able to tell, I don't know what was happening, I don't know. Sure. So yeah, so there we can differentiate, and depending on what time of the day, night it's happening. So if it's happening in the first half of sleep, probably it's related to deep sleep. If it's second half, then it's probably nightmares. Nightmares, they can recall. A person can recall. They don't want to recall, that's different, but they may recall. They can.
So, what will be the good gap between dinner and bed?
Nothing specific. Don't go to bed immediately is what people say. So maybe half an hour, something like that. Nothing specific, but if you're maintaining some standard, half an hour to 45 minutes, that's well and good. There are people who actually have their dinner at 7:30 and they go to bed at 10:30. That may be too late, I would say, but some people practice like that.
And another thing is, it's my question. I tell my grandson to dream about angels, and he will be having good sleep and all those things. Does it work?
I would say you're trying to induce some positive thoughts in the person, right? By saying that angel, you're talking about something positive and good things. The person may not be scared to think those things. So if the person is enjoying what is doing, he or she is doing, then that's fine. That's fine. That's okay.
And I want to know about this cognitive behavior therapy also. See, it is usually we do that cognitive behavior therapy normally also. The same way we can do in the sleep disorder also. In that.
Yes, yes, yes. It's the same principle. It's the same principle. So just these dreams are collection of subconscious thoughts, subconscious ideas. So so same way the negative thoughts are being replaced by positive thoughts. You do the same way.
And usually I get a dream like that I've lost something and I don't get it back like that. And even in my day-to-day these things, if I don't get anything immediately, I will get tensed. There will be a lot of anxiety. Even in the kitchen, if I don't get anything means, I will get anxious. So what is the connection with that, with the dream and also this thing? Same.
Yeah, I'm not sure about the dream, but it's a kind of you're trying to be perfectionistic. So if you ignore, no, I'm not bothered. If you think it is a big thing, it will become big. If you just ignore, then it won't magnify and worry you. And now with the amount of information that is going inside the brain, it's too much. In one day, the amount of information going through, talking to somebody, watching TV, watching radio, listening to radio, or even emails, WhatsApp, and voice calls. There's n number of things, and your brain is bombarded. So and we are harming our mind by bombarding with a lot of information. At some point we have to say it's too much for today, and we have to maintain that hygiene. That's health hygiene. So there's some term called as digital dementia also. So we may not pay attention, and we might forget, and then we realize later. When we are calm, we realize later where that thing is found. So same thing holds good, I think. And multitasking should be avoided. You should never do multitasking. I mean, that's been a standard practice, but as far as possible, multitasking should be avoided, because only one signal goes through the brain at a given point in time. So if you are driving and speaking on the phone, the signals actually switch once regarding the phone call, once regarding what is happening in front of you. So you're actually switching. There's only one signal that passes. So you can imagine, your brain may be super brain that is collecting that bits and pieces of information, giving you enough information, but that is what is happening there, switching. So it's not ideal that you switch, and that harms the brain, because the brain is being trained to switch from one topic to another topic suddenly. That will affect the concentration. And concentration means poor short-term, poor memory. So learning will get affected.
Some questions are you have already answered while you are giving.
There's one question on what is the treatment for REM behavior disorder. Yeah. Well, REM behavior disorder, if it occurs, it's better that the person goes to see a maybe neurologist or a psychiatrist, maybe possibly neurologist. The reason being, it can be a prodrome of one of the cognitive related problems for the future, or Parkinson-like illness in the future. So it may be a prodrome. It may not be, but it's better that they go and see a neurologist at the earliest. The treatment for an behavior disorder include simple clonazepam or similar kind of medication that we give, and it works well.
Dr. Vijay, can you?
Yeah, I can hear you. Who is it, please?
Mahesh.
Dr. Mahesh speaking.
Yes, sir. Please tell me, sir.
Can we give melatonin to elderly lifelong? Because melatonin always it is found in low level in elderly, no?
I don't know about whether it's found in low level in elderly, but I don't know whether it's enough. Although it is low, it might be enough for the elderly. But melatonin definitely, what I've tried, whenever I tried in elderly patients, most of the time it has worked. I would say 50 to 60% of my patients, when I've tried melatonin, it has worked. For some people, it doesn't work. So if it works, fine, you can carry on. But for long term, why to unnecessarily give medication for long term? The good thing is it may not be habitual, it may not become addictive, but still somebody has to review, because melatonin has not been studied for long term. But melatonin does help in rescheduling the sleep wake cycle, or adjusting the sleep wake cycle. So it is good. It is a good medication, especially in delirium. If somebody is having insomnia, restlessness at night, to help them sleep, it is being used. It is a very good drug. So to use it on a need basis. If you ask, do you want to give a pill to somebody to sleep for rest of their life? No. Don't believe that. There's no alternative to normal sleep. Taking a pill and going to bed, or taking a bit of alcohol and going to bed, I won't recommend that. No.
How long you have tried in your patients melatonin? How much milligram?
3 milligrams, and I've gone up to 6 milligrams. So don't if you are giving medication as you're prescribing some medication for sleep to somebody, you must tell them that it's temporary only, and so that they don't get addicted to it. Because, and if you notice, many people are already on medications for long time. Somebody must have prescribed them alprazolam, Vestil. The name is a misnomer, Vestil, Angsit, Vestil, Angsit, and they take it for rest of their life. And apparently, and ideally speaking, the chemist should not issue without a prescription. But many are on it for a long time. It's not advisable. No. Long-term use of benzodiazepines to sleep can affect memory and can fasten the Alzheimer's process. One or two studies have shown that.
Doctor, in sleep apnea, they don't get relaxation to their brain. What will be the side effect of it?
Yeah, so if somebody has not slept well throughout the night, next day's performance will get affected. The concentration will be poor, and the sleep deprived. It's similar to deep sleep deprivation, as though they have slept only 2 hours that night.
It is continuous. Every day they will be facing the same thing.
Yes. And it can change the personality of a person. I don't know whether you noticed, but some people can become irritable, very irritable, if they don't sleep well at night.
Short temper.
And and then we had seen in adult sleep deprivation led to psychosis even. And after 2 nights of good sleep, the person is fine. So whether you want to call it as a psychosis or a mania, or some kind of a label you want to give, I don't know, but so we ultimately thought it might have been related to sleep deprivation, because the person was healthier until that time.
So I don't see any questions in here. So thank you so much.
One second, madam. Any participants would like to ask any questions? You can unmute yourself and ask your questions. Anybody would like to? Yeah.
Hello.
Yes, sir. Please go ahead.
Hello.
Yes, sir. We can hear you. Hello.
This is one question. There are dreams, unusual dreams, which we have not experienced or seen anything in the past. And wonderful dreams have been seen. How it is possible?
It could have been a mixture of all the past events, mixture of few events.
So I have not seen, I have not experienced it. Past means so when actually. Is it in the subconscious mind or in the conscious mind? Because I have experienced conscious mind.
What the science know is that it can only be from the past experience, because the dreams are coming from the mind, so it can only be from the past experience. Either that past experience might have been a mixture of past experience, who knows. So that is the reason. So we are not, we don't have any clarity on exactly where it's coming from and how it's happening. There's no method to study where it's coming from. So that is a problem.
Is it because we dream in the day that such things should be happened, and we are dreaming actually in the daydreams? Such things should have happened, and we just see in the daydream that one
That can
dream
happen. That can happen. That can happen.
that may
That
come
is
in.
a principle. That is a principle of the dream therapy. So if you practice repeatedly, there's a likelihood that you might get that same dream at night.
Very good. Thank you, sir.
Thank you. Anybody else who would like to ask any last question, or we can wind up the session?
Dr. Vijay, most important thing in sleep hygiene is these elders, they should switch off their TV and mobile 1 hour before they sleep. This has been studied extensively, so that this screen light, it affects.
Correct. Blue light can affect, so it can stop the melatonin secretion or reduce the melatonin secretion. That can affect. So not ideal, but many people do. I also do, but we shouldn't be doing that. But
it works well.
We are now.
Thank you, sir.
Okay, anybody else? Okay, then I think we can, okay.
Does power nap involve REM sleep? If the person has not slept for 2 nights, this is one more thing I need to mention. If the person has not slept well for 2 nights, let's say imagine 4 hours and 4 hours at night, 2 nights, third night, he or she need not have to go and sleep for those, make up for those additional time. Okay, what happens is the architecture of the sleep pattern itself changes. So the person may have a early REM quickly, in 5 minutes they may have a REM. So somebody asked the question, does power nap involve REM sleep? Yes, they can have. If the that may be a problem, in fact, because see, if the person has not slept well at night, they can have early REM next day. So power nap shouldn't always have REM sleep, but it's a usual sleep. So I don't think we are yet into study of power naps, but you can keep a record of what is happening in the power nap. But try and avoid daytime sleep. It's best. That's best.
Okay, I think we can wind up the session because it's already time. Okay, so thank you so much.
Yeah, thanks, Gina. The reason for recording is that I was traveling last 2 nights, so I thought I'll record and give it to you, and so that.
But it doesn't feel. Yeah, it didn't feel like it is a recording. We were literally, it felt like we are watching you presenting the session.
Thank you.
Yeah, it was great, sir. Thank you so much. So I would like to thank all the Zoom and YouTube participants who have participated for today's session. And thank you, Sudha Nagendra ma'am, for moderating the session and introducing about Vayomanasa Sanjeevani. And I would like to especially thank Dr. Vijay Harbishata sir for coming for today's session and presenting a wonderful topic for us. With that, I would like to thank all our partners, Government of Karnataka, Indian Psychiatric Society, Karnataka Chapter 1, Karnataka State Legal Service Authority, Bangalore Apartment Federation, Samadhana Counseling Center, and our funding partner, Icon Life Science, REC Foundation, and NSC Foundation. Once again, thank you all. Have a wonderful evening.
Thank you, sir.